Welcome to the Veteran Psychedelic Discourse. We are a group that advocates for safe and responsible exploration of mental health treatments. This is not a platform for the solicitation of illegal substances. Dr. Chris Romig is the Director of Innovation at the Stella Center and the board-certified MD provider. He stays on the forefront of research and literature pertaining to the use of biological treatments and psychedelics in the treatments of often debilitating conditions. With experience in the field since 2016, he has developed innovative and novel protocols to maximize the beneficial effects of ketamine to the whole individual. Stella's main treatment modality is a biological treatment called the Dual Sympathetic Reset, an advanced Stellate Ganglion Block, and Ketamine Infused Therapy. The clinic also offers traditional talk therapy, medication management, and other holistic therapies. Welcome, Dr. Chris Romig. Can you just give us just a quick description of yourself and just how you kind of got into this type of work in the first place, and then what caught your eye as far as like ketamine?
Sure. So, as you said, I'm a board certified anesthesiologist. So, ketamine for me is something that I was trained on from kind of day one of my residency. In 2015, started seeing some literature kind of pop up about, ketamine's amazing kind of treatments, modalities, and things like treatment resistant depression, anxiety disorder, PTS. I'm going to be calling it PTSI because it's more of an injury than a disorder. Some chronic pain syndromes, a few other things. So in 2016, I set up the first ketamine center with some colleagues of mine that's still there. But I left a few years ago because I wanted to go in a more kind of total body, holistic way, add in some, new modalities like the dual sympathetic reset, and just work more closely with, therapists, very integrative type of approach. I stay on the forefront of, all the literature. I'm a huge believer in kind of all the psychedelics, but as an MD, the only one that I can, currently, prescribe and use in my treatments is ketamine. Although probably in the next 12 to 18 months, we're going to see psilocybin and MDMA kind of come down the pipe as they get FDA approved. So I myself have been involved in probably over 8,000, ketamine sessions now. And I just see all the time, kind of the amazing results. The important thing that I want to stress as we start here is that psychedelics are amazing. They're amazing tools, but that's exactly what they are. They are not this magic bullet. You truly need the combination of, therapy along with what the psychedelics, specifically for me, ketamine, do. I always tell all my clients the greatest healer we have is actually within our own mind. And the ketamine allows you to find that kind of path to healing, but you need to process, what you're seeing, during that psychedelic experience. You need to process there with, with your therapist so that you're able to, make these kind of changes long lasting. So I'm a big believer in, the combo therapy, and really just seeing absolutely amazing, results. Treated a lot of veterans, a lot of first responders, and it's just been, kind of an amazing type of thing. So that's kind of things in a nutshell. I joined Stella about 6 months ago. The combo of the dual sympathetic block and the ketamine is amazing. What a lot of people don't understand is that all psychedelics, ketamine included, can actually initially increase your kind of anxiety levels, your fight or flight, or increase your sympathetic tone. So oftentimes we'll see kind of an initial uptick with anxiety during the first two infusions, and then it goes down as they're processing and they're feeling better. When you do it in combination with the stellate ganglion block, or what we call the DSR, that is immediately taken away. And I get into the science, a little bit later as we get into the questioning. But when you do the combo of the two, it's just absolutely kind of amazing results. And what we see, oftentimes I'll see depression, anxiety, trauma scores drop 75, 80, sometimes greater than 90%. So I currently run my clinic in Irvine, California. So I service a lot of Southern California, LA, San Diego areas, and work with some pretty amazing companies outside of that. So one of the biggest things that I've found going into any psychedelic experience is creating what's called the peaceful mind. You truly have to prepare the mind before going into any psychedelic experience. And your intention of going into that is also huge. Every time you go into a psychedelic experience, you have to have an intention of what you're hoping to find, what you're hoping to work through. And I always try to keep it in a much kind of positive light. So in creating that mind, I use some virtual reality. This company called Firefly VR has created this world called the Sanctuary, and in it, it does things like ritual breath, setting intentions, creating positivity, letting go. And when you actually take the time, even 10 minutes before a session to do that, it changes everything, for that session. The other one I work with is Tara Mind, that was set up by ex-Navy SEAL Marcus Capone, and what their primary focus is getting psychedelic and psychotherapy covered by, employee health, and then hopefully eventually by, just regular health insurances. So just really trying to bring about where we can get this treatment more to the masses, because right now it is mostly out of pocket, and so many people need the healing effects of it. That's kind of me in a nutshell. Happy to answer any questions you may have or thoughts.
I was actually wondering if you might be able to explain a little bit more of the VR process and kind of maybe some of the work that the clients would do there. I just
Sure.
find it so unique, such an interesting way to involve technology while using cutting edge therapies. So yeah.
Yeah, so in being a huge believer in the psychedelics, as you see a lot with the ayahuascas and the psilocybins and some of the other ones like the 5-MeO DMT, things like that, there is a ceremony involved. And ketamine, in essence, I think it needs to go along those lines, even though it's a synthetic one, but preparation is key in this. And what I've found, and I started this about a year and a half ago, is people would come in with anxiety, and we would just kind of heighten that anxiety. And I've my colleague who's out in the KC area, Dr. Ray Brovon, called me one day and he's like, I have this lady, she just has debilitating anxiety, and the ketamine just doesn't seem to be helping her. It's getting worse. And I don't know, it's just one of those lightning strikes, light bulb moments. I said, Ray, do you have, one of those Oculus headsets? Just put her in it and, you know, do a really calming scene. And, he did. And he called me afterwards and he's like, oh my God, she's completely different. She feels relaxed. She feels calm. She's watching this seaside setting and looking at seashells, and it just made her entire experience. So we just completely flipped. And then I was able to partner with this company called Firefly, and Shell Mann is their CEO, and they've developed this world called, specifically the Sanctuary. It was initially designed for ketamine centers like mine specifically, although they're quickly branching out more into mental health. But you go into it and it's just this amazing virtual world, and you kind of sit at the overlook, and on one side is the study, and in the study it has all these videos on what ketamine is, the science behind it, what your session is going to be like integrating with your therapist. Then it also does videos on ritual breath, how to breathe, how to focus on different areas of your body when you're breathing. And then the other side, where they have the fireplace, you actually do these things. So like the ritual breath, you select on it and it takes you to this amazing seaside setting, and there's just very calming woman's voice, and you see this kind of ethereal Buddha beating floating in front of you, and then it says take a deep breath in, and it actually shows the breath come in and you hold it and out, and it just really calms the mind down. And then some of the other sessions I'll have them work on setting intentions or letting go. Like the letting go one, you grab little stones off the table and you throw them into the lake, or setting an intention, you actually pick words out and, and create those things. And that is just huge going into it. So the virtual reality just in essence is like the ceremony before their session. And the last thing we talk about is what is our intention today. And oftentimes the first ones are about, letting go, why we're here, what are we trying to work through. And as they progress, they get more positive. They become things like, okay, today I want to work on inner strength. I want you to picture yourself as having this, this globe or this orb around you, and that is your field of strength, and nothing can penetrate that. Or connecting to the world around you and loved ones, or joy or happiness. And when you do that, it truly makes a huge difference. The one that I've found almost is a game changer for a lot of people, especially those that have trauma. And I myself am a survivor of some childhood and then adult trauma. And we talk about all the time this very wounded inner child. We're very disconnected from them. And I've had some clients that I say, okay, today I just want you to find your inner child in there. Find them, play with them, make them feel safe. And when they do that, it's literally like a light switch flips, and they're able to again kind of feel very connected to their core. So setting that intention, I just can't stress how important that is going into any type of session. And then after that, we give them questions to answer, to journal, so that they can then follow up with their therapists. So it truly is an amazing experience. And with me, I invoke all 5 senses. So I use that VR before. They have weighted blankets, noise canceling headphones, eye covers, aromatherapy. Oftentimes I'll give them a mint for taste. I'll use some light therapy afterwards. I have a hyperbaric chamber. So, I'm really kind of integrating this. It's much more than just coming in and getting the ketamine. All my infusions have high dose antioxidants, B vitamins, amino acids, all things that are cofactors for the ketamine. And I really have just, seen a tremendous uptick in these kind of subtle changes in terms of the results of, what I do. So.
I was also curious. I saw that you do work with the dual sympathetic reset, but you're doing that in conjunction with the ketamine therapy as well. And I was wondering if maybe you could explain that process a little bit, and maybe even like in a way that we might be able to understand like what's going on biologically there.
Sure. Yeah. And so Dr. Gene Lipoff with Stella was the one that perfected this dual. So, when we hear about stellate ganglion blocks, we just think about the one that's at the C6 even. And what he has found is that oftentimes the trauma is carried not only there, but in what's called the superior cervical ganglion with 6 at C4. And in somebody that has a lot of trauma or, PTSI, they're in what's called your fight or flight. You're in a very high sympathetic tone. So you're always on edge. You're always, prepared for the next bad thing. Your heart rate's up. Sleep is disturbed, everything. And when you're in that state, it doesn't allow you to frankly process very well. It doesn't, you can't kind of tap into, those inner feelings and trying to work through them. So the way that the stellate ganglion or this dual sympathetic reset works is that those areas, the stellate ganglion and the superior cervical ganglion, send nerve fibers up to area of the brain, couple areas, the part of the limbic system, which is the amygdala and the hippocampus. And that's where, our fight or flight, lives. And in those areas, they've done some studies, and, Gene describes it so well, but I tell all my clients, in those areas, you almost have these little nerve fibers that kind of look like dandelions. There's these little spindles, and these spindles, when you're in your high trauma state, are pumping out norepinephrine. And norepinephrine is the fight or flight transmitter. And when you have a lot of trauma, complex trauma, you have all these little spindles in those areas of the brain, and they're pumping out the norepinephrine, and you're always on edge. So what we have found is with this dual sympathetic reset, when we block those, and we only block it for about 8-10 hours, but think of them as the CPU for your fight or flight, for your sympathetic system. And when we turn it off, we're resetting it. And we've actually found that those spindles immediately turn off pumping out norepinephrine, and they actually get pruned. So I've had clients just feel immediately lighter, immediately better, some sleep for 24 hours. We've had results of 6, 9 months, over a year of relief. We get people coming off, their medications and things like that, able to process better. It's truly amazing. And then when you cut that sympathetic down and use it in conjunction with the ketamine, the ketamine now, when used with the DSR, you're now tapping into, okay, what are we working through? What are we letting go? And because you're in a much more relaxed state, you're able to fall into that experience much better. Oftentimes people are doing psychedelics, they have a lot of, fear and anxiety. What is this experience going to be like? And, the initial ones, they kind of fight it until, they trust in me, trust in the experience. But when you take away that fight or flight, they just tend to have much better experiences. And honestly, I would recommend it before any of the psychedelics for that same reason, is that will cut that sympathetic tone and allow you to have a much, better kind of psychedelic journey. But I didn't know a whole lot about it up until about a year ago, but since I've been doing it, I've just been blown away by, how well people do after it. Truly people that can't leave the house or feel just completely debilitated, and then their life just completely turns around. So it's quite amazing.
Do you find that the residual effect of the psychedelics tends to last a bit longer when you use the dual sympathetic reset?
That's a good question. We're just beginning to look at the combination of the two. So I can't directly answer that question. I know we have looked at those just with, say generalized anxiety disorder, doing the block cuts their symptoms by 50%. So even if they don't have per se trauma in their past, but they just have a lot of anxiety, just the block itself really cuts things down. I think long term, yeah, we will see those. The effects of the ketamine themselves just are quite amazing. I've seen, we used to, back when we first started, we used to think that if you do, 2 ketamine sessions and you're getting no results, then you're a non-responder. Well, that was very early on. And then as the studies came out, it actually looks like it's not until session 4 where people really start kind of turning the corner. And I see that all the time. Like the 4th infusion, I'll have clients be like, that, I feel amazing. It tends to be across the board, that 4th infusion. And then, people may require boosters, but I've seen people kind of booster out of that. I'm also kind of a big believer in the combo. So I've had people switch from ketamine to kind of micro dosing of psilocybin, and that's not something that I can touch as an MD. But those clients that have gone that pathway have told me that they just feel great, and I don't see them back for boosters. So there probably is a pretty interesting combination of switching people from ketamine to, microdosing of psilocybin that should probably be looked at somewhere, down the line. But yeah, the combo of the DSR and the ketamine is quite good. And Stella does work with a lot of special ops in that. So they'll do, the DSR on the right and left side, and then they do, ketamine infusions on top of that. And the results of that are pretty good and are going to be published fairly shortly.
How long between sessions, and how do you give the block?
Sure. So I am a big believer that you need time to integrate between your infusions. So I recommend no more than 2 a week. So I tend to do 2 a week over 3 weeks is how mine works. And that allows you time to journal, allows you time to process, allows you time to, work with your therapist. I think when you're doing more than that, say 3 a week or more, it just doesn't give you time to recover. The block itself, we do it in my clinic. It's ultrasound guided. The block itself takes me literally under 10 minutes to do. You're monitored, the whole time. And when you have a block, we know we got it when you get what's called a Horner syndrome. So on that side, you get your eyelid droops a little bit, the white part, which is called your conjunctiva, turns red, or what we call erythematous, and then your pupil actually changes sides. So it's a different size from the other one. You may feel flushed or congested on that side. And those are all signs that we got the stellate ganglion.
So, yeah,
Go ahead.
it's an injection or not an injection?
Yeah, it's an injection of a local anesthetic. So to block any nerve, you use what's called a local anesthetic. And we use mostly bupivacaine. And when you use bupivacaine, it lasts anywhere from about 8 to 10 hours. And we found that by shutting the stellate ganglion off for that amount of time, it's the great kind of reset for it. So people just feel, better kind of right away. I then tell them, you really need to take it easy for the next day or two. So avoid caffeine, avoid stressful things, really let your body reset.
So that whole session lasts about how long?
The block itself, about 15 minutes. Then we watch you anywhere from, another, depending on if you have sedation for it, another, 45 minutes to an hour.
Do you work with people high functioning on the autistic spectrum with just anxiety that's paralyzing?
Yes. Yeah, definitely.
You have good experience with those. Those need to be treated a bit differently.
No, especially not the high functioning, as long as they're going in, understanding, setting the intentions and those type of things and what they're there to work through, they do just fine. There's actually some literature to support psychedelics and autism in general. It tends to kind of rewire a lot of those circuits. So
Alicia
there's
Danforth did a study out of Southern California, I believe. Yeah.
Yeah. So
Thank you.
hopefully we'll see more of that down the pipe as well.
I was wondering, Chris, we're doing the veteran psychedelic discourse, so maybe you could talk to some of your experiences about working with veterans. I know we mentioned that a little bit beforehand. I wonder if maybe this might be an opportunity to kind of inspire some young men and women to maybe go get some treatment through this modality. So maybe if you could talk about some of the experiences others have had.
Yeah, I've had quite a few SEALs come through my clinic, Marines, Army, first responders as well, and just kind of amazing, results. I've had a few that have had some, unfortunately, in the veteran population, suicidal ideations and even suicide attempts run kind of rampant. And I've had some just, amazing results with that, where they come in and we truly get them on, a better track. I can tell you a funny story about a session, and he was a SEAL. And one of the things during the session is you're listening to music, and if that music stops for whatever reason, it can break the psychedelic experience. And he was in this session, and he was just it was one we were working on. It was one of his later ones. He was working on, joy and happiness. And he said he just was surrounded by all these colors, and he was having just amazing, kind of feelings of joy and happiness. And the music cut off, and he immediately went into warrior mode, and he grabbed his gun and he shoved all the happiness and joy behind it because he wanted to protect it. And he woke up from that experience, and I said, see, that's exactly, you're now protecting that which you didn't have before, that joy and happiness. And he was becoming what I like to call, especially for veterans, the warrior monk. You have to transition from that sort of warrior, training and understanding into, the monk, where you let things kind of flow, and you really try to find, peace with everything. Just across the board, I've just kind of seen, amazing results with veterans. And we've been doing more of the block and then the ketamine. And again, I'm just, seeing kind of great results. And there's a lot of trauma, in veterans, a lot. And unfortunately, the VA system doesn't allow you guys to truly access a lot of, things that work, and speaking with Marcus and hearing, all the things that he went through, as a SEAL, and, finding, redemption through psychedelics. He did his with Ibogaine, but just a big, believer in all of them. And, he did everything through the VA, the TMS and the hyperbarics, and ran all the studies and tests and everything else. But it wasn't until he was able to do a truly integrative psychedelic experience that he was able to find this kind of path to healing. And I truly believe that's what the psychedelics will do and help within the veteran population, as long as it's used in conjunction with, with therapy. You have to have both. But it's, yeah, in terms of veterans, it's just been, amazing. And since I had a grandfather who was at Pearl and my dad also served, veterans just, carry a very special place for me, and I want to help in any way that I can. So.
Yeah, definitely grateful for that. We do have some questions from the audience. The first was from Blaine, and he was curious about what kind of doses you were using for the ketamine therapy you guys were doing.
Sure. So, as you know, ketamine can be done nasal, oral, IM, and IV. I'm anesthesia trained, so for me, the best, I think, the one that's easiest to control, has the greatest bioavailability. And what I mean by bioavailability is the brain sees it for this kind of steady state concentration. And the only one that does that is IV. So I'm fairly standard, what the studies have shown. So anywhere from 0.5 milligrams up to 1. Now, there's variability there, and I've been doing this long enough that I know kind of where to go with my dosages. Depending on medications, I may have to go higher. Depending on if somebody's very sensitive, I may have to go lower. Usually we started at the lower dose just because we want to make sure. What a lot of people don't understand about psychedelics, and there's been, a lot of studies about it, is you can actually induce what's called a bad trip. For ketamine, it's called a K-hole. It's where things are very dark. There's demons and things like that. And all psychedelics have this sort of therapeutic window, and it looks like an inverse U. And if you're too low on the U, you're getting none of the benefits, and then you hit that kind of maximum benefit, which is at a certain dose. And then if you keep going above that, you're now going on the downside of the curve, and you can actually give enough to where it's like you didn't give it at all, and you now just have all of the bad side effects. And when you have a bad trip or K-hole, studies are showing that's actually detrimental to you. So this is one thing I will stress: wherever you go, just make sure that they have experience, they know what they're doing. Because I've had a few clients that have come to me that have had just horrible experiences. Their provider kept going up on the dose. They were going into deeper and deeper K-holes. They came in with depression, and now they were developing suicidal ideations because those providers didn't understand that going up on the dose doesn't mean that you're getting more and more benefit. So, but that tends to be kind of where my dose range is. But I do tailor it to the individual depending on, their medications, their history, if they've done other psychedelics, things like that. So.
Are there any medications that like people should be aware of if they're interested in ketamine infused therapy?
Yeah, so the big one that works the most negative is, of course, the benzos. So things like Ativan, Klonopin, Xanax. Those work unfortunately negatively with the ketamine. So in essence, they just don't give you benefit. There's some other ones, like some antipsychotics and some seizure meds, where I basically just have to go on much higher doses to kind of overcome those negative effects. Those tend to be the only ones. Somebody that's on, a big worry about some of the other psychedelics is if I'm on an SSRI, things like that. With ketamine, you don't worry about that because it works through a completely different mechanism. It's not the serotonin receptors, it's the glutamate and MDMA receptors. So, that's the beauty. We get a lot of people on, the Zolofts and the Paxils and the Celexas and everything else, and there isn't a contraindication with those in doing ketamine.
Awesome. We have a question from AJ. He wanted to know about the anesthetic you were using. I think you mentioned that, but if you wouldn't mind repeating it.
For the dual sympathetic
Yeah,
reset.
sorry, yeah.
Yeah, so it's a local anesthetic called bupivacaine. So, there's a bunch of different local anesthetics. Lidocaine's probably the one you hear the most, but that tends to be, on the shorter acting side. But then we have things like bupivacaine, which is a very popular one. It's longer acting. Ropivacaine, is another one. So all locals work through blocking what's called the sodium channel on a nerve ending. So when it blocks, the nerve just can't conduct. But we use bupivacaine for that, and it lasts anywhere from about 8 to 10 hours.
And then he also had a question about I believe from what I read it was a dual injection. And then where are the locations and why do you guys do the dual injection?
Sure. I kind of mentioned before, so Dr. Lipoff found that the C6, which sits right about here, is where the stellate ganglion lies. It's actually one level below, but we eject at C6 because that's the safest place. And then the superior cervical ganglion sits up about C3, C4. So usually the two injections are right here. So what I do is I use the ultrasound first. I see where everything is, and that usually tends to be the longest part of the block. I then mark those two areas with a little purple pen and inject the skin there with local, and then we use the ultrasound guided needle down to those areas, inject local. And the reason that we block both, again, is that, Dr. Lipoff has found that the trauma is stored in both of those, and both those areas send nerve fibers up to the amygdala and the hippocampus. So he's found much better results in blocking both. And that's one of the things that differentiates Stella from anybody else doing, the sympathetic reset.
So that's something that's unique to you guys.
Yeah, pretty much. And he also kind of found it on one of those kind of lightning bolt moments. So he had a SEAL actively suicidal and came in, did the block, didn't work. The guy's like, that's it, I'm done. I'm leaving here, and I don't care. I can't live this anymore. And so again, Dr. Lipoff just had this sort of light bulb moment. He said, you know what? Let me just block the upper one. So we went back in, blocked the upper, and the ex-SEAL was like, I feel amazing, instantly better. So he then started looking at, oh, wow, maybe we should block both. And he just has now found so much better results from that. So it's kind of amazing sometimes, the things that are placed before us, and we have to think outside the box. And when we do, we get even better results. And, I've seen that with the ketamine and the combo. I've seen that adding the VR in. Sometimes you have to think outside the box to truly make a difference.
I'm really glad you phrased that, the thinking outside the box. I actually saw you do a lecture a while ago, and you'd raised something. We were talking about how a lot of the research appeared to be geared towards removing the psychedelic experience from the psychedelic. And you had commented on the importance of the journey in recovery and healing. And I was wondering if you might be able to speak to that, because I've spoken to a few other people, and that just strikes me as a very profound observation about the role of psychedelics and, kind of that it's not just eliciting a physiological reaction, that there is a process that's going on internally inside the person. So I wonder if you might be able to speak to that.
Yeah, definitely. There actually was a recent study, and they're not quite sure what to make of it, but basically it's with ketamine and people undergoing general anesthesia. And we've already seen multiple studies showing the benefit of ketamine, but what they did is they had people and they split them up into two different groups. They were just having general surgery, so things like having their appendix out or gallbladder. But they had the people in the different groups all had depression, anxiety. So they gave one side, they did their normal general anesthesia stuff. They gave one side nothing, and then the other side they gave ketamine, and they looked at the scoring of depression, and they found that there was no difference between the two. So one of the theories is because when you're under general anesthesia, you're not experiencing a psychedelic journey. You're not experiencing psychedelics in any way, shape, or form, but you're still getting the ketamine. So to me, that just kind of really hammered home how important the psychedelic journey is. And I see it all the time with clients that come in. They were just like, the things that I saw there were absolutely amazing. And that's what I say all the time. The greatest healer we have is actually within our own mind. And, the ketamine is allowing your mind's eye to find that path to healing. So to me, it's these drug companies are trying to, take that psychedelic experience away. I don't think you're going to find nearly the success rates that you do with, with the regular psychedelics. I mean, if you look at things like psilocybin and ayahuasca and some of those, they're now being used in the world of addiction. They're almost like this perfect medicine. You can't get, it's addicted to them. They have, like with psilocybin, you develop a tolerance to it very quickly. If you're using sort of the higher doses. Now that tolerance comes off, but you're not getting, addiction goes through the nucleus accumbens, and you get in, whether that's alcohol or, other types of drugs, and you get into this sort of cycle of reward with higher dopamine levels. The psychedelics have this amazing kind of downstream mechanism that shuts off that sort of dopamine surge. So you get that kind of initial one, but then you don't keep getting them to develop this addiction. So again, to me, the psychedelic journey is 80%, or shouldn't say 80%, because it's when used in conjunction with, with the therapy is what really does it. But you need that psychedelic experience to kind of find your way. And I've seen that kind of across the board. They just did a big meta-analysis study just looking at ketamine itself and the different ways of giving it. So, nasal versus IM versus IV, this S-ketamine, which is Spravato, versus racemic generic. And with all the studies, they show that the Spravato itself is inferior to the racemic, and that nasal is inferior to doing it IM or IV. Which is what I've kind of seen over the years. I've had people try Spravato and just it did nothing for them, and then they did the IV, and they just had amazing sort of healing journeys from it. So I think the studies will elucidate, and to me, the holy grail down the line is figuring out which modality works best with which psychedelic. So for PTSI and addiction, is it something like Iboga? For depression, is it ketamine? For anxiety, is it ayahuasca and psilocybin? I'm hopeful that someday we'll be able to kind of figure that out. But right now the ketamine does amazing things for all of those. So
How do you assess the effectiveness of your treatments?
sure. So when someone comes in, we go over all their medical history. We speak with their mental health care provider, and then I use a scoring system. So I'll use, the PHQs, the GADs, the PCLs, and an ACE score, which is the adverse childhood events. And we do that before the first infusion. Some centers will do it, before the third or fourth. I just do it before the sixth. And then I see, I show them their scores from before their first and then before their sixth. And just had a gentleman the other day finish, and his scores across the board went down, over 80% from them. And he himself, says, yeah, I feel amazing. I feel so much better. So I do a number score for that, but of course you have to look at everything else. How's their sleep? How's their energy levels? How's their, job, interacting with friends and family? And often friends and family are the ones that notice first. Like, yeah, he joked with me. He smiled with me. He came out of his room. He was up before noon, things like that. So, but we use that kind of scoring to assess. And that's what most of the studies do also, is they kind of look at the scoring changes.
What are some of the challenges you run into in treatment?
The biggest kind of challenges I've run into, initially it was kind of, oh boy, where do we go sort of with these doses and things. as I've been doing this for so long and I've seen different things, I don't really get much into that, in terms of bad effects. I don't have people that go into, psychosis or bad trips. Um, for me, kind of the biggest one is that, they're really following up with their therapy. They're truly kind of integrating things, and they're believing in the process. Frankly, I can tell when somebody's fighting and fighting falling into the ketamine experience, because they're pulling off their eye covers, their earphones, so they're trying to stay awake instead of letting the mind and that healing journey take over. So there's some little things I can do to, and I call it throw them into the pool. So those are some of the challenges for me.
What do you think probably the most effective way to foster belief in the clients is? Do you think it's just kind of the mindset they come in with, they maintain, or do you have any techniques or tactics you use to kind of maybe educate and kind of bring them on board?
Yeah, it all depends sort of on the individual client. Some, they have a lot of fear about the experience. So often have somebody there that helps ground them. So hold their hand. Others I may have to, play with the dosing a little bit, make sure that they fall into the experience faster. All of my clients, when they come in, they pick their own grounding stone, and the grounding stone has been great for them. It's just a little reminder of why they're there. They hold on to it during the experience. They keep it in their pocket afterwards. So if they're having a bad day, they can reach into their pocket and be like, yeah, I remember what I was seeing in that, that ketamine session, and it calms them down. So a lot of times it's just reassurance. So I'll have somebody there holding their hands. I'll have somebody there with them. I usually don't like people talking to them during the dosages that I'm at, because I don't want to put an idea in their head and it takes them down a wrong path. I want them just to be fully immersed, and then they can process after. So it's very individualized in my practice, because I've been doing this for so long. So that's the important thing, is that the clients need to know that who they are they're part of a much bigger thing. They're a father or a brother or a mother. They're part of a much larger thing. So they need to be understood that we are truly looking after them on an individual basis, but they're part of a much larger family of people, and we tailor our treatments to them. I try to get everybody in the VR, but some don't like it. Some want different types of music. Some want not to wear the eye covers. Some want, different things. And we tailor it to the individual, because we truly want it to be the best experience for them.
To pull a question from the chat, what are your thoughts on ketamine and epileptic seizures?
Well, that's one of the ones that, the medications that they're on, we have to overcome. I've treated people that have epilepsy. Ketamine itself doesn't induce seizures, so I just have to tend to go in higher doses because of things like Depakote or some of the other ones that somebody may be on. But I've had good results with people with seizures.
What is like your process for like selecting people for treatment? Is there a process you go through?
Yeah, so usually, we require them to have a therapist. If they don't, I work with so many amazing therapists in the area and able to get them with, whatever thing that they're coming in with. Oftentimes you want to see that, treatment-resistant depression, they've had it, for years. They've been, the different medications have all failed. When we work with, closely with the therapist, those tend to be the big ones. And then trauma is a little bit different. Anxiety, some of the pain syndromes, like there's been some studies to show it helps with things like long COVID and Lyme disease, and some autoimmune things like fibromyalgia, things like that. So it kind of depends on what they're seeking treatment for, but especially for like depression, really want to work closely with with their therapists.
What are some barriers people might run into trying to access this treatment?
I mean, currently right now it's cost. It's not covered by insurance, although we're starting. hopeful to see, kind of changes there. I'd give all my clients their super bills, CPT codes, everything like that. Some have been able to get reimbursed. I do know that Kaiser just signed a contract with Ketamine Center of LA. That's Dr. Mendel's group, to kind of trial seeing covering, ketamine therapy. Now that clinic does other things like TMS and some other stuff. But it was, to me, very hopeful to see that, Kaiser may be, embracing, ketamine, and, we're trying to prove this. So, we're compiling all this data so we can take it to employers and be like, look, this really should be covered as part of employee health. But to me, the biggest barrier right now is cost.
Typically, what is the cost for a like a full treatment of ketamine?
So for me, it's and it varies widely by area. Like around me, I think it runs anywhere from 500 to 850. Mine's currently at 575. Now that includes, sessions with the Stella therapist afterwards. So it's around $3,400, for me for the 6 sessions.
Just out of curiosity, do you know what kind of approach the therapists at Stella use for the integration work?
Yeah, it's mostly kind of follow up, see, how their session went, things like that, discussing how they felt during the experience, any insight that they have. I can tell you, I do a lot of interviews for TaraMind around the country to, basically vet these clinics, make sure that they're safe. I'm beginning to see a lot more of these kind of high-end clinics doing total integration. So, they're doing the ketamine sessions, they're doing the integration afterwards, the follow-up. Some are taking on med management, things like that. And to me, that's the best approach. There's too many centers out there where you just come in, you get hooked up to ketamine, zero preparatory work, zero integration, zero anything after. So to me, if you need a center, definitely find one that offers you that ability to integrate, that ability to create the peaceful mind before. So that's kind of what I'm seeing, is that we are, and as the psilocybins and the MDMAs come down the pipe, these centers will be well positioned to adopt those, where someone's coming in and okay, today we're doing our psilocybin session, or MDMA. Now those are much longer. A ketamine session with me, the infusion itself takes about 50 minutes, and it's about another 45, and you're out the door. Once the psilocybins and the MDMA come, there you're looking at 6-8 hours. So it's a different ball of wax in terms of how your day is, things like that. So centers will have to kind of adjust. Tying a chair up in a therapist for 6-8 hours a day, it's difficult. So we'll have to see how things kind of play out once those are FDA approved.
I understand that you were in MAPS back in July, and you were just talking about FDA approval. I was just wondering if there's any discussion out there about any of the maybe upcoming changes or anything that's going on. You mentioned about 12 months to 18 months psilocybin and MDA potentially being legal for therapies. Any other news or info?
Those are the ones that I, mostly hear about. The biggest thing is, okay, these are coming down the pipe. How do we, assure that the therapists are getting, proper training, that providers are getting proper training for it? There isn't really a, gold standard. MAP has his recommendation, or they have their recommendations. There's IPPI, there's other ones that are coming down for like ketamine. There's ASKP3 recommendations. So even this company I work with, Tara, we're looking to set up our own kind of training modalities, because we have experts in the field that have been doing this for years, and we feel like we would be able to offer amazing training, and it would be for free, because we're so we really feel like there needs to be some proper training and stability brought to this field, because it's frankly the wild west right now. And I think you're going to see some tumultuous years once this stuff is approved and trying to figure out what's best. So again, I stress, if you're seeking psychedelic treatment, just make sure that they have, a few years under their belt and they're very safe.
I'm glad you brought up Taramind. Could you talk a little bit about the organization and kind of the work they do?
Yeah, so Taramind was set up by Marcus Capone. He's ex-SEAL Team 6. He healed through Ibogaine. Just had an amazing journey. Nothing else seemed to be working for him. And in doing so, he and his wife, Amber, really want to help, others. He has his own organization called VATS, and he helps special ops, mostly I think they go down to that center he did in Mexico. But he wanted to bring this, more to the masses. So he set up Taramind with the understanding of, we're working very hard with, to get this covered by employee health. So, there are negotiations with some pretty big, companies right now. So, let's say you're in the LA area and it's a company that we have partnered with, and, you're an employee and you've been struggling, and the company will be like, well, look, here's Taramind. They have vetted this clinic in LA. We'll send you there for, ketamine therapy, some integrative therapy. We'll cover up to, $5,000 or $6,000 of your expense. So we want to do this across the country. The other thing that I love what they're doing is they want to compile all this data from all these different clinics that we work with and prove and show, hey, look, less days missed work, less visits to the hospital, less utilization of medical care, less use of medications by doing these type of treatments, so that then we can go to, insurance companies, be like, look how much money you're saving, by, covering these type of treatments. Marcus is doing amazing work on, on the ground. He meets with legislatures. He's on, TV, podcasts, interviews. He works with some of the biggest in the field, like, the Andrew Hubermans and, the Robin Carhart Harrises and, the Michael Polans and all those, in the field. So we're really trying, but again, their biggest push is that psychedelic with psychotherapy. You need the combination of the both. But let's get this out there. Let's get this to the masses, and, in a safe and, a way where it does get covered, and those that can't afford it, they can get treatment. So.
Have you published any of your findings? And is there anywhere to send someone for more information on this type of work or research?
That's an excellent question. I have a whole library myself of data from, the different studies. Stella Center is compiling a lot now. They have stuff, of course, published on the Dual Sympathetic Reset, the DSR blocks. We're hopefully going to be compiling it on the combo of the DSR with the ketamine. I know they are working on that they've been doing the special operators, block and ketamine for, I think, 2 years now. So I think they have a fair amount of data that they want to get published. They're also working with, NYU and some other things, looking at, functional MRIs before and after to actually kind of show, the difference. In the future, we want to get into, biofeedback and, looking at, different sensors. Hey, look how your heart rate variability changes. Look at, your blood pressure, your sleep, all these other things. But yeah, if there's any individualized questions, I'm happy to, send studies their way, things like that.
Awesome. We have another question from a guest saying, I feel the sublingual method isn't nearly as beneficial. What are your thoughts?
Yeah, so I touched on this a little bit. So any drug that enters your system, it goes under the laws of what's called bioavailability. And with ketamine, so let's say the top of the food chain is IV. So 100% or 95 to 100% of your brain sees that ketamine. When you do IM, it drops down to 90 to 95%. The problem with the IM is you have to give a bigger dose. You get this kind of crazy peak, and then it quickly decreases. With the IV, I equate it to like taking a flight, and they've done some studies where you want to be kind of in the therapeutic window. So you, with the IV, it's a nice kind of subtle takeoff. You have this kind of cruising altitude, and then, you know, a nice kind of descent and wake up. IM, you get the peak, and then you're never really in the therapeutic zone. Nasal, oral, sublingual, you actually never enter the therapeutic zone because the bioavailability is oftentimes under 30%. So sublingual, it's anywhere from about 25 to 30. Nasal is around 30%, and then oral tends to be under 25%. And that just all has to do with kind of this first pass effect. So it gets metabolized by the liver, or the absorption isn't as good. So for me, the one I've seen the greatest results with and is the safest is IV. So let's say somebody is coming in and all of a sudden they're having a bad experience. I can stop it immediately. If you're doing oral, IM, nasal, you're in for the long haul unless they're, you know, injecting other medications in you. And then, you know, if you're giving benzos, things like Ativan to stop it, well, then you just wasted that experience. So, you know, for me, the safest, the best way is IV, but I'm anesthesia, so I'm extremely comfortable giving it that way. Other providers just aren't, which is why they do, you know, the nasal or the IM, or, you know, things like that. And I've done some interviews with some clinics, and, you know, I'll ask about side effects and IM, and oh, I've had a few laryngospasms, and I'm like, whoa, what? That's where your vocal cords can slam shut. And I'm like, well, what'd you do? And, you know, other ones be like, I'll ask them, well, what do you do if they have, you know, laryngospasm? They do these things, and their answer is calling 911. Oh, that's not what you want to hear, as if, you know, you're going to those type of clinics. So to me, IV is the safest. It's, you know, the best experience along those lines. So
Yeah, can you speak to the trend, politics, or financial of ketamine clinics closing down, boom and bust across the United States?
yeah, that's a great question. So you've um you know, kind of one of the first clinics that opened up was in 2012, and you sort of saw this kind of slow uptick. And then over the past few years, it's just been an absolute explosion, because everybody and their brother's getting into it, thinking they know what they're doing. So yeah, there were some big kind of companies that closed shops, so ketamine wellness centers, Field Trip. I think they had good intentions. But there's just so many mom and pop shops out there that, you know, can set different price things. And in this field, you have to grow out, not grow in. And I think unfortunately, those companies set up a lot of clinics hoping people would come, but there's just such stiff competition that, you know, their prices were so high, they went elsewhere. So, you know, if they had grown steadily, um, you really just don't. There's a couple of centers that may have, you know, 9, 10 in a given area or a few given states, but I don't think you're going to see a national provider. And honestly, when the psilocybins and the MDMAs come, I think you're going to see even more of a contracture in the ketamine space. And clients are getting wise. Like I told you, I can't even count the number of clients I've had go to other centers where they just hook them up, and it just, yeah, they had kind of a, per se, a psychedelic experience, but they got very little out of it because their mind wasn't prepared, they weren't integrating. And you know, these people look on the internet, they look at chat boards and things like that, and you know, they expect better results, so they will go to centers, you know, like mine that do that. So I think you will see more of these ketamine centers kind of close, especially as the other psychedelics come down the pipe.
Yeah, we have another question from the chat. It says, can you explain more about developing an intention, maybe to what to think about or consider besides I want to get better before a ketamine session for best results for people with PTSD?
Yeah. So for me, you know, let's say you're coming in with, you know, with that trauma. Our very first session will be, you know, oftentimes in letting go. And I'll give you like visualizations. So I often tell, my clients, life is like a river, that water's always flowing forward. It never flows back. And we have to understand that. So in letting go, we can't change the past. We can't. I mean, believe me, there are oftentimes I wish I could go back and undo something, but we cannot. So we have to understand that what's in our past can never be returned to. That being said, we can heal from it and let it go. So during the first few sessions, if it's letting go that we're working on, it's visualizing whatever it is, embracing it, hugging it, letting it go. I'll often say, picture yourself, it's fall and leaves are falling all around you, and you're standing on this bridge over, a stream that's running by. Grab one of the leaves and, whatever you're trying to let go of, put it in that leaf and then drop it in the water and watch it float away. Or you're sitting on the end of a dock and there's one of those, light lanterns, and there's, fireflies all around you. Grab one of those fireflies, put them in that lantern, think about what you're trying to let go of and let it, float away from you. The one with finding your inner child is huge intention. Find your inner child, tell them how much you love them, tell them that you're there to protect them and you're never going to let those bad things happen to them again, has changed countless people under my care. Had a guy, 3 suicide attempts, and was doing well with the ketamine. And I just said one day, how's your journey with your inner child? And he's like, I haven't seen my inner child in years. And so that's what we did. I said, look, find your inner child, just play with them. Just play with your inner child, go down slides, play games. And that's exactly what he did during his session. He woke up and he just is, it still kind of chokes me up to this day. He's just like, I feel amazing. So his subsequent sessions were all about, making his inner child feel safe and protected. So that's a huge intention for me. Oftentimes, I'll get them where, they'll say things like, I want to figure out why, I hate myself, or I want to figure out, why I, do these things to myself. And that's a negative energy. And people need to understand going into anything that we have to find these positive energy things. So I flipped the narrative and I said, instead of, thinking about why I hate myself, let's instead focus on why you are the amazing individual that you are, finding that inner strength. And when you flip the narrative and create it more of positive energy, the mind desperately wants to go in that way. It does. It's tired of feeling the way that it is. And I call it a reestablishment of your happy pathways. So those pathways where you're feeling good start to fire, and like a muscle, when you work it out and it gets stronger, it's the same with those neuronal pathways. And studies have shown that those areas of the brain are lighting up again. So for me, setting that intentions in a positive way is huge. Today we're connecting with the world around us. Focus on your loved ones. Focus on those things that make you happy. And when you do, they go in there. On the flip side, I've had where, they're coming in, they had a bad drive, or somebody upset them and they were anxious and they couldn't calm down from it. And, in the back of my mind, I'm thinking, God, we should probably just delay this, but they want to do it. Well, of course, that anxiety gets heightened because those were what they were focused on going in. So for me, intentions is everything. So really creating that peaceful mind before, and then, working on an intention. And I often tell them, okay, for your next session, I want you to think about what we're working on, so that when you come in for it, I want you to tell me what your intention is. And then I may tweak it depending on, how they're approaching it, how they're viewing it, in order to make it, much more kind of positive.
I'm glad you brought up the inner child work there. That's an incredible process to go through. Yeah, that's just so profound, knowing that you've got people in your office that are doing that. That's just that's an amazing reward.
Yeah, I mean, for me, I think trauma is all all kind of inner child, based at its root. Addiction is all, kind of inner child at its root. I probably wouldn't be on this conversation if I hadn't been able to, heal my inner child with somebody that was able to get me down to my inner child and, get them out of that very dark, scary place, tell them how much, I loved him and I'm here to protect him, and then get him into, that it changed my life completely, wanting to numb myself, wanting to, you know, surrounding myself with negative energy and negative people because I felt like I deserved it. But when you flip that narrative and you embrace your inner child, you know, like attracts like, the universe sends you, positive people, positive energy, positive vibes. You don't want to numb yourself, with substances or things. So that's a big part of what I work on with. And in many ways, I'm just giving back to the universe. It healed me. It's time, with my skills, it's time for me to heal others. So.
We do have a question from the audience who wants to know if I went online. It looks like Stella is actually kind of nationwide. There are a few other locations as well. Maybe you kind of speak to some of the areas they operate, and maybe also talk about some of the areas where ketamine therapy appears to be maybe the most popular or is growing, in a way that will allow it to be sustained.
Sure. So Stella has what we call 4 Stella-owned centers or flagship. Their first one was in Chicago. That's where Dr. Lipoff and most of the senior people was Stella. I was the second one in, Irvine. They just loved what I was doing in the space, especially with virtual reality and integration. And I was doing the blocks myself. And then they took over 2 of the field trip clinics, one in New York and the other one in DC. Now, all the other centers you see, it's just we've partnered with, say a pain doctor in Florida, and we will then send, clients in that area to that center to have the block. Now, the 4 main centers do the dual sympathetic reset and ketamine. The ones that aren't Stella owned mostly just do the blocks. If they do ketamine, it's kind of on their own. So that's how the Stella, it's kind of a hybrid model. So we own these 4. We're hoping to open up, a few more centers that are, Stella owned, in the Dallas area, probably San Francisco, maybe Atlanta, and down in Orlando or something. But that's all kind of in talks. And that was your ketamine question? I'm sorry.
Well, they were asking the individuals in Arizona, and so my curiosity is, if you have somebody who's listening to this and they want to check out the network of Stella partners, what would be a good way for them to kind of check into that?
So if you actually go on the website, it'll show all of the location of Stella providers, all around everywhere. And it'll show you the 4 main ones, and then all of our, collaborations with different Stella partners around the country. And there's quite a few. The beauty of that model is we can, go into areas that aren't, a big metropolitan area like LA or, New York, but, some of the smaller areas of the country. So
I have someone that I help. I've helped over the years with different journeys. This is the person that is on the autistic spectrum, but high functioning, just almost paralyzed with anxiety. If it's possible, she's not going to be able to afford a whole series of 6. Is that a block to even starting it?
yeah, I don't recommend less. I mean, I've seen over the years, like I said, it's usually the 4th one where we really kind of see them turn the corner, and then it's that kind of next 2 that really hammers it home. The other thing is we want these effects to be long lasting. When you do less than 6, the studies show it just doesn't last very long. But 6, and some people do 8, 10, we tend to get kind of longer lasting effects from it. There are some things like care credit and with cherry that are you can kind of do where it's it's like a low interest, type of loan things. So
Yeah, she only works, in fact, the fact that she works is amazing, but she only works part-time. And so she doesn't accumulate much.
yeah, she may call the Stella Centers, and the block may help her just with the anxiety itself. She could give, the intake people a call, and that's the right side of blocks, right around 1600. So that might be, more economically feasible for her.
Okay. And you say the right side, what does?
Yeah, so when we do stellate blocks, depending on kind of the trauma, we found those that have really complex trauma or early childhood trauma need both the right and the left. But we're seeing in about 80% of people, they just need the right side done. So one side done.
Hmm. Okay. Would there, just as far as being able to possibly show her that there is some hope for it to try to continue, doing one, is there a chance that that can give someone hope that there can be something?
Yeah, that's not something I can really recommend. It
Understand?
may. Yeah. They would just, like the studies have been done where they'll do, one and they may get, you know, 2 days of relief. It's just not long acting, which is exactly why we do it the 6. We want this really to be kind of long acting. So
Yeah, it's just to give her some hope so she would continue.
yeah.
Yeah.
Yeah, that's kind of a fine line. So
Right.
yeah,
Well,
sorry.
okay, no, that's fine. Thank you.
We have some questions in the chat. Do you want to read them, Alex?
Sure. I always hear about past trauma related to this therapy. You mentioned people changing in the present. Can this help with ongoing trauma?
Yes, it can. And the block can as well. So I've seen it with a lot of veterans and then first responders that have this sort of ongoing trauma. What we see when we reset you is that it completely resets you. So the same things that trigger you just don't. You're in a much calmer state. So you're able to, process in a better way. I see it the same with the ketamine. So what it does is it literally just allows you to, to reset, to be in that calm state. So the same traumas just don't elicit the same kind of downward spiral that you see. And I had a police captain who had the block, and he's still under the same stresses, but he was a year out, and he's just like, I just don't get triggered like I do before. I just feel calm, and that's what it is. And it's I hear that all the time. People are like, yeah, it was so weird. I didn't react the way that I used to. That's because we have reset you, we have rewired you, and you believe in that. So yeah, it can help with ongoing trauma.
We have another question. I believe you mentioned a little bit about this before, but could microdosing psilocybin, possibly self-sourced, fit into your model? Would it be better before or after your series? You said that there's some people that have microdosed post the treatment, but it's not exactly within your scope, right?
Yeah, until it's FDA approved, I can't really touch it as an MD. All the clients that I've had that have transitioned, it's always been at the tail end. So, kind of after their 5th and 6th. And my only advice on microdosing is that, if you're sourcing it yourself, make sure they're doing quality control, because, if you're just getting some mushrooms and trying it, your dose can be all over the place. It can be from 50 one day up to 400 milligrams the next. So just make sure that you're getting kind of a steady, state when you're doing it, or a quality controlled state. Otherwise, it won't work for you because your brain won't be getting that same dose every day. It's going to be all over the map. So that's my only advice on that.
Is there much stigma with first responders for this therapy?
Not for the stellate block, no, because that's just a nerve block. But yeah, first responders and psychedelics, unfortunately, there still is. That being said, I've I have, first responders that come in because to them it's much more important, to be feeling better than the stigma of psychedelics. We're trying to change that with everything, and I think the pendulum is starting to shift. But in terms of the dual sympathetic block, no, there's no stigma with that.
Yeah, I feel like it's just like a matter of time, right?
I hope so.
Yeah. Yeah. Well, if that's it, then I'd like to thank our guest, Dr. Romig, and the audience for joining us today. If you're watching this on YouTube and want to join us for a future show live, then check out our Meetup page so that you have a link for one of these sessions and see what type of future events we have on the calendar that we have planned. And we meet on the third Sunday of every month at 11. So with that, thank you. Have a good one, guys.
Have a great one.
Thank you.